Hello and welcome to Doc Talk Live. This is NorthBay Healthcare's way to reach out to the community on important health issues. Today we're talking with one of our great OB-GYNs, Shanna Snow. Dr. Snow, take it away.
All right. Hi everybody. Thank you so much for joining us. We know you're busy and you got lots to do, and hopefully we won't take up too much of your time. I just want to start by saying that, the talk today is here about COVID vaccine, specifically in pregnancy and postpartum. Convince you to take the vaccine. I feel like, we still have so much information we're gathering on a daily basis. Really, my goal today is to give you information for your partner. I definitely realize as an OB and a mother myself that pregnancy is just a different time than any other time in your life, and immediately postpartum and breastfeeding. I mean, we cut out things like coffee, even though the studies show that it's completely safe and we can have a couple cups, we just don't take any chances. People don't take Tylenol, and it's the safest medication there is practically. So we understand that, avoiding things in pregnancy and postpartum and breastfeeding is just natural, but it's a difficult time. This is something that we have to talk about and we have to think about, and I do think there's some good evidence that it's very safe, but I think that's a decision that everybody has to make for themselves. And we also have to think about, our community and our world. So we have ourselves and our baby to take care of, but every person that gets vaccinated may help the next person that is even more at risk than the pregnant patient from getting sick. So it's just tough. One thing I will say is that I personally believe that I believe in science, I believe in research, and so there are a lot of theories out there that just don't have a lot of fact base to them, and I won't be addressing those. I'm happy to do that in clinic, make an appointment with me, but for the most part, I really trust that our scientists and our government are working to help us as a whole and not to harm us, and that the research that is coming out is valid. So starting with just COVID-19 infection in general, what do we know beyond essentially a reasonable doubt? We know that COVID in the United States has killed about 1.8% of people that it's infected, and there's different numbers out there, but that's one of the sources that I found. We know that pregnant women are just as likely to get COVID infection as anybody else, so they're not more likely or less likely. But when they do get pregnant, the majority of pregnant women and immediately postpartum women will do great. They'll have no symptoms, mild symptoms, they'll recover. And so, our goal is not to scare anybody into thinking that everybody gets sick, but in the women that do get sick in the pregnant population or recently delivered population, more of those people will get severely sick, will end up with things like being hospitalized, ending up in the intensive care unit, on breathing machines, or having to go home on home oxygen, all the way through the really scary stuff like being placed on a ventilator and even dying. One study that I found that has come out since all of this started showed about a 5% chance of becoming critically ill. 30% may have severe symptoms but sent home on oxygen, things like that, but only about 5% will be admitted and potentially end up in the ICU. So that's a really significant number compared to the general population, but it's still overall low. We know that. There was a study that came out of the University of Oxford on about 2,000 pregnant women that showed a 20 times increased risk of death. And it was a really well done study. They compared each pregnant patient they looked at that was positive for COVID, they compared to two non-pregnant patients in the same time that, two pregnant patients in the same time period that were not sick with COVID. So we know that they took out a lot of the variables for, differences in summer versus winter. So 20 times increased risk seems absurdly scary, but I like to qualify those numbers. when we think about how many women in the US die in pregnancy in a year, it's 0.006%. So very few women do die, but 20 times that is 0.1% of women. So that, you know, comes a lot higher, and maybe is something that people would look at and convince them that the vaccine would be beneficial for them to consider. The numbers that they had in that study placed the pregnant lady, who is generally young and healthy, in the same risk category as the 50-year-old with complications and comorbidities. So we know that pregnant women are at higher risk than you know, just average out there. Definitely, if our pregnant patients or postpartum patients have other comorbidities like lung disease or diabetes or high blood pressure, then that's going to increase their risk even more than these baseline numbers that we have. We also know beyond a reasonable doubt that vertical transmission is very, very rare, and that means mom getting COVID infection and that transmitting and going through the placenta to fetus. We have seen cases, but they're extenuating circumstances, some mixing of mom and baby's blood, but for the most part, we are not seeing that. We also know that term and preterm newborns can get COVID, and we have seen that even in our own hospital. They rarely have symptoms or anything that needs to be treated. However, they're finding over the last year a new complication called multisystem inflammatory syndrome in children that sometimes will present weeks to months later, and it's not until they go back that they found that more of these kids had a positive COVID test or positive antibodies. So even if they had no symptoms at the time of, they're having symptoms and potentially long-term repercussions later. We also finally know beyond a reasonable doubt that COVID infection can increase the risk of a preterm delivery. Sometimes that may be related to the fact that mom is so sick that we have to deliver her to help her, but it also can just increase the risk of spontaneous preterm labor and preterm birth. What experts think we know, but we don't really know for sure, is that COVID itself can come with some long-term symptoms and risks. Some of the things that we've seen are this similar to in children, this multi-system inflammatory disorder where different parts of the body get swollen and inflamed even long after the syndrome of COVID itself is over. We're seeing some long-term complications in lungs, people that are still continuing to have respiratory difficulty long after. Loss of smell is another one that you've probably heard in the media. Chronic fatigue and brain fog seem to also be a concern, although we don't have as much information about those because they're so multifactorial. And even things like post-traumatic stress disorder and depression and anxiety are seeming to come along with COVID because of how stressful the hospitalization and experience can be. Some of the pregnancy outcomes that we're not 100% sure, but we are seeing trends, are increased risks of C-section with COVID positive, especially symptomatic patients. Increased risk of preeclampsia or other blood pressure disorders that can lead to hypercoagulation, too much clotting in the blood, and even things as scary as eclampsia like seizures and blood clots. Those are already increased risk in pregnancy and immediately postpartum in the first 6 weeks anyway, and because COVID infections come with an increase in coagulation, they're making that risk higher. We also think that babies under a year old might be the highest risk of infants in terms of severe illness because their immune systems just aren't very well adapted yet, and they have much smaller airways that can't cope with much mucus. Some of the things we definitely don't know is any long-term risk from offspring of a mother that contracts COVID in pregnancy or during breastfeeding. We don't have any reason to suspect that if it's not the primary infection of the infant, but we just really don't know. We don't have that information yet. So when it comes to the vaccine itself, again, I'd like to go over what do we know, what do we think, and what do we really not know. We know 100% based on the science, maybe I should say 99. I don't feel like anything's ever 100% in the world, but 99%. The vaccines are extremely safe. Again, I'm not somebody that believes that the scientists are trying to get us with vaccines, and if you believe that, I'm happy to have a conversation in the clinic, but that won't be what this talk is about. We know that vaccines reduce death from infectious disease. We've seen it. We've seen diseases completely eradicated, and we've seen them significantly dropped and affect a lot fewer people than they would have without vaccines. And we also know that vaccines are not related to autism, even though some studies have shown that in the past. Those studies were then debunked, and studies after that have all not linked autism with vaccines. So generally, vaccines are very safe and effective. We've been, excuse me, giving flu and Tdap, or whooping cough vaccine, in pregnancy for decades, and we've had no signs of anything long-term or short-term complicating that, but we've also seen a lot of decreased risk of whooping cough in the neonatal period when infants are most at risk for it. So you know, we have some good vaccines out there that we know are very safe in pregnancy. COVID's not one of them yet. We haven't gotten to that point where we can really say that. We all know that all of the vaccines, whatever brand you receive, is highly effective in preventing severe disease. It's not 100%, and it certainly doesn't protect all infections, but preventing hospitalizations, we're seeing that a lot. We have pretty limited data on the safety of the vaccines in the pregnancy. We're working on it. The CDC and the FDA, Federal Drug Administration, are actively gathering data. We have post-vaccine reviews that are going on. Anybody that gets the vaccine is encouraged, if they're pregnant or recently postpartum or breastfeeding, to sign up for the V-Safe, V-SAFE system, where they can give you updates. If you have any symptoms that develop, you can sign in and you can send them updates. If there's something particularly concerning, they'll actually track you down and get more information from you. So we're doing the best we can with the time and the information we have to get data, but it's still super early. From the data we have, we've seen not one concern in pregnancy or in breastfeeding moms as far as the vaccine is concerned. We do have some data, not a ton, showing that rates of miscarriage, stillbirth, diabetes, preeclampsia, growth restriction, preterm delivery, and congenital anomalies are the same between pregnant women who've received the vaccine at any point in the pregnancy, first trimester, second, or third, and moms that have not received the vaccine. So there's a baseline rate of those always for any pregnant woman, and there can be some confusion sometimes because as mothers, I think, of course, we always think like, well, if something goes wrong, it has to be related to the vaccine. But unfortunately, those things just go wrong in pregnancy at a certain percentage all the time. And we're seeing those percentages be identical between patients getting the vaccine and not getting the vaccine. We also have some really good animal studies, which aren't the same as human studies, but they're decent, showing no safety concerns for the vaccine for the patient or the offspring. Some other things that we know for sure are that mRNA vaccines cannot give you COVID itself. So there's no concern of that. We have not seen that once, and it's just scientifically impossible. mRNA vaccines also cannot change your DNA. They do not go into the nucleus. They're not able to alter anything. We can always talk in the clinic if anybody has questions. Give me a message or make an appointment about how mRNA vaccines work, but they cannot alter the DNA. We know that the mRNA vaccines are relatively new. We've had the science for years and years, but this is the first time we've used it in a vaccine. And so for patients that are concerned about that and all the long-term data that we maybe don't have, The Johnson & Johnson vaccine does use a form of vaccine that has been used for many, many years and has been shown to be very safe. The Johnson & Johnson vaccine, we do have limited data again showing an increased risk for blood clotting and low platelets. And we also know that that's a risk of pregnancy in general. So we're still trying to figure out, if the Johnson & Johnson vaccine is the safest thing for our pregnant and recently postpartum patients. But the evidence that we have right now says that the risk is still extremely low, and we are not cautioning against getting that vaccine if that's the one you have access to and you desire it. The other thing we know is that side effects after the vaccine, especially after the second one, if it's a 2-dose vaccine, are super common. And I keep joking that I was actually really happy when I got my second vaccine because I got some chills, and the first one I felt nothing, and so when I got those I was like, yes, it's working. It's working. I'm so excited. So we know that side effects are good. They show that your immune system is responding to the vaccine, and I've had the question, is it dangerous to have those mild side effects in pregnancy? And we know beyond a reasonable doubt that it is not. It's not harmful to you, nor is it harmful to your baby. It's very safe to take a little bit of Tylenol for the first 24 to 48 hours if needed, as well as Benadryl. And most of the side effects are extremely mild and will go away, but nothing long-term will happen from those. Severe side effects from any vaccine are possible, and that goes between pregnant women, not pregnant women, children, young, old. I recommend that at minimum you stick around after you get the vaccine for at least 15 or 30 minutes and just make sure you don't have one of those severe reactions like stopping breathing, anaphylaxis. This is not more likely in pregnancy than it is anybody. If you've ever had a vaccine that resulted in that kind of reaction, you're at increased risk. So you're the person I'd probably say, unless you really needed the vaccine, we're going to hold off until you're done. But the chances of this are extremely, extremely rare. And should somebody develop severe reactions, if they're in the setting where we can monitor them and get them help quickly, then the risk is very low, even with that kind of severe reaction. Finally, what do the experts think about the COVID vaccine, but not know? Every bit of information we have right now says that it's extremely safe. We don't see any risks to mom or to baby. Evidence that we have so far also shows that the antibodies that moms are making if they receive the vaccine, either during pregnancy or while they're breastfeeding, are transferred across the placenta in many cases, and that peripherally protects the baby against COVID, at least until those antibodies wear off, and that can be several months after they're born. And then in breastfeeding, those antibodies are being passed across into the breast milk, at least for the mRNA vaccines, the Pfizer and the Moderna vaccines, we're seeing that. We have not seen any risk, again, of miscarriage, and one of the other questions I've received a lot, and I want to clarify, is risk of infertility, both short and long term. And I can say without a doubt that in my personal practice, even though we don't have all the information, we are not seeing that. We're just seeing, if anything, we're in a boom right now. We're not in a slump. Patients that have received the vaccine either early in pregnancy or just before getting pregnant did not have any more trouble than anybody on average getting pregnant. As far as recommendations from societies that are out there that deal with pregnant moms and breastfeeding moms, the College of OB-GYN, or ACOG, the Society for Maternal Fetal Medicine, the World Health Organization, and the CDC are all recommending the vaccine in pregnancy and or breastfeeding if they haven't received it in pregnancy. So, again, obviously, as I'm saying this out loud, I do feel like it's very vaccine heavy. And, I think that that's a little bit of my bias, as well as the data is really showing that it's safe. But I do feel like, again, it's in pregnancy, it's a very personal choice. patients have asked me, well, would I get it? And I say, well, that's really tough because I'm not currently pregnant. So I don't feel like anybody can make that decision for a mom that's carrying a baby. I think that's something that's entirely up to you. But if you're leaning one way or the other, the data is very much pointing towards the safety of the vaccine versus the risks of COVID itself, and the vaccine wins. If you are still not 100% sure one way or the other, again, we're always happy to make an appointment with me or one of the other providers at NorthBay. You can educate yourself, and I have some information that I'll hold up here while I continue to talk that we'll zoom in on, and you can try to write it down. This is a really great website that has tons of information. You can look it up online, you can email questions, call, text, or even go onto a secure website and send that out. I think that it's always important too to look at your own individual risk. For me, if I was pregnant, I have to go to work and I still have to see patients, and so my risk of COVID is going to be a lot higher than the mom who can stay at home and doesn't have to interact with the general public on a routine basis. So that always has to be taken into account as well. Other than, asking questions for us and other providers. I think we're good with that. Mm-hmm. Okay, so hopefully you got that, or you can pause it and look. I got one more here. If you are at the point where you think, I'm ready, I want to get the vaccine, where do I go? These are multiple sources that you can go to sign up for the vaccine. I think you can still call NorthBay directly if you have a primary care here, but if not, these are all the sources, and anybody, including NorthBay patients, can use these. And at the moment, we have a surplus, so anybody that wants to get it can sign up and pretty much get it the same day or within a few days. And finally, if you choose not to vaccinate, again, I do feel like it's very much your choice. But I would then, of course, fall back on the standard precautions that we've been talking about this whole time. Avoid crowds, wear your masks, wash your hands, avoid touching your face in public. I mean, these things are almost so commonplace we could say them in our sleep. We want people to do that still, whether they're vaccinated or not, but especially in the case of a mom that's at higher risk or a newborn baby. We want you to take these precautions and avoid getting COVID at all costs. If you have any more questions, please let us know, and I hope this was helpful.
Okay, we do have a couple of questions that we sort of prepared in advance. You talked about people who still have questions and they're not really sure. If I'm a patient and I come into you and I'm in that situation, what kind of factors are you going to go over with me to help me figure out what's right for me?
Yeah, and again, every person is different. I mean, I think your own personal beliefs and your own personal risk are super important. So my aunt is an example of someone that really has the ability to avoid being out in public at all costs at this point. And so, when I talked to her about getting the vaccine versus not, my counseling was a little bit different than, say, somebody that's in the healthcare field that constantly is coming in contact with people with COVID and doesn't really have any choice. So that's one very important factor. Obviously, your particular medical complications and risks would come into play with how I would encourage you or not to get the vaccine, depending on whether it's safe for you and how at risk you are for COVID versus the average person without any comorbidities.
Okay. And you talked about not being able to, well, let's just ask this. So if they're not going to pass COVID on to the baby, can they pass their immunity on to the baby? In other words, if you get the shot and you have antibodies now, will those antibodies be passed on to the baby?
Correct. So while you're pregnant, it's very, very rare, again, I wouldn't say zero, but very extremely rare, extreme circumstances that you can pass COVID itself across the placenta to baby. But with the vaccines, we are seeing the antibodies pass across the placenta. When you're postpartum, if you had COVID asymptomatically especially and didn't know to protect yourself, you can pass that to your newborn, and if you're vaccinated, that's less likely that you would pass it to your newborn. At the same time, if you're vaccinated, especially in the 3rd trimester, you'll be making antibodies that we have seen in the breast milk, at least with the Pfizer and Moderna vaccines at this point, and those antibodies will protect baby for several months. You know, at least for the most critical time of the first couple months to 6 months of life.
Okay. And then just finally, if a pregnant woman does decide to get the vaccine during pregnancy, does it matter when she gets vaccinated? 1st trimester, 2nd trimester, so forth?
Yeah, it's a tough call because we know the evidence so far is that the vaccine is the most protective for baby in the 3rd trimester, and that's similar to what we have seen with the whooping cough Tdap vaccine, is that we recommend that between 27 and 36 weeks because you have fresh antibodies, you're passing them through the placenta, you'll still be making them and passing them into your breast milk. But because COVID is so scary in our pregnant patients alone, at the moment, we're not recommending that you wait until the 3rd trimester. I think, again, that's a personal decision, but we want people that want to get the vaccine to get it before they get pregnant, actively trying to get pregnant in the 1st, 2nd, or 3rd trimester. At any time, if you want it, we would like you to get it.
Okay. Well, we've reached the 6 o'clock hour here, so our chat is done, but we want to tell everybody to join us for our next Doc Talk Live, which will be on July 28th at 12:30 p.m. with Dr. Jay Shoebrook. He's one of our diabetologists, and he's going to be talking about managing diabetes on a budget. Thank you, Dr. Snow, for today.
Take care.